Hello, 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 everyone. How's everybody doing this afternoon? This is Dr. Nicole Edwards, board certified family medicine physician. I help everyone, all busy individuals who are overworked, overwhelmed, and overweight to transform their mind, body, spirit, and finances by explaining medical conditions in terms that everyday people can understand. Thank you so much for joining me live today. We are back with Talk with the Doc, and I am so happy to be back doing this broadcast. And we're going to be back every Sunday at 5 you all by Abundant Life Concierge Medicine and also by Abundantly Natural. Abundant Life Concierge is the medical practice where we bring whole person healthcare to people in a way that's convenient for them, right? And then Abundantly Natural is an all natural health and wellness line with vitamin supplements and all things natural to help you live a whole person healthy life. All right, again, thank you so much for joining me. We are live currently, and so hey there, Dr. Z. Thank you so much for joining me. I hope that you all have fun. Today, we are getting ready to enter into Heart Health Month. February, the month of hearts, the month of heart health. So I'm going to just drop some quick tips on how to stay heart healthy. But before we get into that, I do want to talk to you guys about COVID-19. I know, I'm sure you all are just overwhelmed with hearing about COVID. You don't want to hear about it anymore. But I just wanted to come with you guys to talk to you a little bit about how COVID-19 affects your heart, okay? Because that's very important. I know, especially with Omicron out currently, it's kind of been a milder virus, and because it's milder in its symptoms, people are not as worried about getting it, okay? But I wanted to talk to you about some of the long-term effects of getting COVID-19 and what it can do to your heart. So as we know, with Omicron, it is actually spreading more rapidly, all right? And so I want to make sure too that everybody remembers how to prevent the spread of COVID. Some very simple things we can do: wear your mask over your nose, under your chin. I went somewhere yesterday and I saw so many people that just had the mask on just over their mouth. And I was like, you do know that's like having a condom, but in your pocket. Like, it doesn't do anything. It's not protecting you if you don't have it over your nose and under your chin. All right, so it needs to cover your whole face. All right, so make sure that you're wearing your mask properly, especially with Omicron, because it spreads so rapidly. You only have to have your mask down for a little bit for it to spread quickly. Omicron tends to stick more in our throats, in our upper respiratory areas, so it's easier to spread and it's easier to get. So make sure you're wearing your mask. Make sure you are washing your hands. Wash your hands to stop the spread of COVID. If you haven't seen my video on wash your hands, make sure you check it out. It's here on my YouTube channel as well. So make sure you're washing your hands and then go get vaccinated, guys. We know that Omicron is hitting harder with the people who are unvaccinated. So make sure you get your vaccine, get the second vaccine, and make sure you get boosted, all right? Because we know that that is also helping to slow down the symptoms. Now, with Omicron, we're seeing less virulence, which means it's not as, the symptoms are not as bad, quote unquote. So you might have some sore throat or some itchy throat. If I get one more patient who calls in and says, I just have an itchy throat or I have some sinuses, okay, first of all, go get tested for COVID, all right? And sometimes you need to get tested more than once because if it tests too early, you might not show up yet, okay? So, but you're having sinus symptoms, an itchy, scratchy throat, maybe some nasal congestion, some runny nose, and so then some tiredness and some fatigue. You may or may not get fever. With Omicron, we're not seeing as much loss of taste and smell, so don't use that as the only way to know if you have COVID or not. I'm telling you guys, it's easier to know if you are thinking that you might have symptoms. The best thing to do is to get tested and then to make sure that you are staying isolated so that you are not spreading it to others while you're not sure if you have it or not. Okay. Remember, COVID-19 or COVID in general is it's been around for a long time. COVID-19 is new. COVID has been around. It's like, it's a cold. Okay. That's why old school bottles of Lysol said it fights COVID, because it's a cold. It's that cold, that coronavirus. It's the virus that causes cold. So, but COVID-19 causes more severe symptoms. So, how does COVID-19 affect the heart? Well, what we're seeing is that COVID-19 in general causes inflammation over your whole entire body. We see it mainly in your nose, your nasal passages, your throat, in your lungs. That's why we have so many people that have trouble breathing and trouble with their respiratory passages. But we also know that it causes inflammation to your heart. Okay, so inflammation on your heart is going to increase your blood pressure. It's going to put more strain on the heart. It's going to cause more cardiovascular disease, and even causes problems with your arteries, with your blood vessels. Okay, cardiovascular. So the heart itself plus the vascular system, which is the arteries and the veins. All right, I just actually dealing with some people lately who've been having more bleeding. All right, so more nosebleeds, which probably is coming from the thinning of the arteries and things in the nasal passages and in their body because of COVID-19. All right, so make sure, guys, that we are not taking this lightly. All right, oh, it's just a common cold, oh, it's just cold symptoms. Don't say that, because what we're seeing also, even in athletes, and even in um, like you see the games are shutting down and things because of the athletes with COVID. Well, what we're seeing later on is that they're having more fatigue. All right, they're getting winded faster. It's harder to get back to normal. All right, and then if you have high risk for COVID, so if you are overweight, if you have underlying medical conditions, so cardiovascular disease, diabetes, autoimmune diseases, if you have other problems, then it takes even longer to deal with, for your body to heal from COVID-19. And what we're seeing is that we've heard of long hauler symptoms, or those people that have symptoms and problems long term. But what we're seeing too is might not be the severe symptoms long term, but how about just fatigue? Okay, fatigue is a doozy that can kind of knock you on your tail for a little while, right? And then you don't have the reserve that you used to have. All right. Absolutely, Asia. We'll make sure that we talk about that on another on another talk with the doc. Asia says that her daughter is working on a history project regarding Roe versus Wade, and asking, can we talk about our opinion on the overturning of the decision? We will definitely talk with that on another talk with the doc. So, because we know that COVID-19 can affect your heart and your cardiovascular symptoms, again, that can cause more strain on the heart, strain on the blood vessels, higher blood pressures. We are wanting to avoid getting COVID-19. All right. This isn't something like chickenpox. Remember back in the day, I can remember back in the day when parents used to have chickenpox parties, right? And so one kid would have chickenpox and they'd bring all the kids with chickenpox to the room. Okay, so let's all get the chickenpox at once so we can get over it and be done with it, right? That's not what we should be doing with COVID. Let me just say that. That is not what we should be doing with COVID, okay? So you should not be, oh, I have COVID, let's get some other people to get it so that way I can build up my immunity to it. Don't do that. I'm just telling you now, don't do that, because we know that there are long-term effects that we don't know all of. All right, remember, this is novel coronavirus 19. We don't know all that it's affecting right now, but we do know that it can affect your heart. Okay, so as we go into Heart Health Month, I wanted to kick off this all about the heart episode of Talk with the Doc to let you know that COVID-19 can affect your heart. And please, guys, please avoid getting COVID. Again, wear your mask, get your vaccination, wash your hands, and socially distance. All right, you've got to stay 6 feet away from people. All right, and that way we are not spreading the coronavirus. I do have, I told you that today's Talk with the Doc is sponsored by Abundantly Natural. That is my all natural health and supplement and vitamin line. And there are some vitamins and supplements out there that can help you with cough and cold symptoms. So if you guys go to drnicoledo.com, that's DrNicoledo.com, and go to the shop where you can go to /share, you can get my cold and flu bundle. All right, and that has things in it like vitamin D, vitamin C, zinc, magnesium, elderberry, all the things to help boost your immune system and help to fight against cold and flu, so that if you do get coronavirus, if you do get a cold, if you do get the flu, that you are also fighting those symptoms by building and boosting your immune system and by improving your own health. All right, because if you do get coronavirus, we want you to get through it as fast as you can, so that you can become whole person healthy as fast as you can. So hopefully you won't have as much strain on your heart. All right. So again, my cold and flu bundle. And because we're getting ready to kick off Heart Health Month, I am going to be offering everybody who watched today discounts on all of my supplements. So for the month of February, we are going to be doing all anti-inflammatories, all cold and flu, and anything about the heart. You're going to get 25% off. All right, and I'm going to give you the coupon code at the end of the show, and that's going to start on February 1st, and it's going to go through the month of February. All right, so that's how I wanted to kick off the show. All things, remember, COVID can affect your heart, so please avoid coronavirus because we don't want to put increased stress on our heart. All right, so again, for all of you who are just joining in, I am Dr. Nicole Edwards, board certified family medicine physician. I help everyday people who are overworked, overwhelmed, and overweight to transform their mind, body, and spirit by explaining medical conditions to you in everyday terms that everyday people can understand. Do me a favor right now, please hit like, please hit share, and please follow my page so that you can see when we are also meeting and doing other important information. All right. Now, again, this show today is sponsored by, thank you, Miss Rosalind. This show is sponsored by Abundant Life Concierge and also by Abundantly Natural. So now I wanted to just jump in real quick and talk to you a little bit about cardiovascular disease, and it's Heart Health Month. We're getting ready to go into the month of February, the month of hearts, the month of all things love. So let's just talk about cardiovascular health and cardiovascular disease. So cardio, again, means the heart. Vascular is the veins, and cardiovascular disease can be things like hypertension or high blood pressure. It can be things like heart disease. All right. It could be coronary artery disease, which is what happens when we have heart attacks. And these things can lead to heart attacks and strokes. So it's very important that you are treating your heart like it matters, because it does. This is what keeps us alive, right? And so your heart, if it's not beating well, if it's not acting right, it's going to do all kinds of things. It can make you feel sick. It can make you feel tired. It can make you feel fatigued. And it can cause pain as well, okay? So you want to make sure that you are taking care of your heart. How do we do that? Well, first of all, before we get to there, how do we take care of your heart? You need to know what are your risk factors. All right, there are risk factors that we can control, and there's risk factors that we can't control when it comes to our heart disease and when it comes to our cardiovascular health. So risk factors you can control: smoking, okay, obesity, all right, your diet, and your exercise. All right, these are the things that you can control. All right, you can control if you're a smoker, okay, because if smoking increases your risk of cardiovascular disease, it clogs your arteries, it puts a strain on the heart, more strain on the heart. We're talking about strain on the heart today. All right, so you want to stop smoking if you are a smoker. All right, obesity. All right, so if your BMI, that's your body mass index, is over 30, then technically you are considered obese. All right, so the BMI is calculated by taking your height and taking your weight. I always tell people I'm not overweight, I'm just too short. If I was 6'5", then I would not be overweight. Okay, but I'm not. So I'm 5'8", so I still have some work to do myself. So, but if you are obese, then you can change that. All right, take it from me. I'm not telling you what I learned in school. I'm not telling you what I read in a book. I'm telling you what I know. All right, Dr. Nicole used to weigh 370 pounds. Promise you. No lie. I'll put up pictures later on. All right. So at my heaviest, I was 373 pounds. My knees hurt. I couldn't walk up the steps without getting out of breath. It was bad. We're going to do a whole show about weight loss and about how to improve your health. But I had, you name the diet, I've been on it. All right. You name the exercise plan, I've been on it. You name the eating plan, I've been on it. But overall, over the years, over the past 10 to after I got out of residency, honestly, over the past 10 to 12 years, I have lost over 150 pounds, and I'm keeping it off, and still got a little ways to go. All right. But this is one of the ways that I am addressing my cardiovascular health. I exercise every day. Okay. Some form of exercise. I eat right as much as I can, all right? And I am addressing my cardiovascular health, all right? So these are things that you can control: smoking, obesity, and you can control obesity by exercising more and eating the right types of food. And then, so exercise, smoking, obesity, what was the other ones I said, y'all? Exercise, being obese, smoking, eating the right types of food. So this is what Dr. Nicole says: if it grows in a plant, don't eat it. If it grows as a plant, eat it. What does that mean? We need to be eating more fruits, more vegetables, all right? More fruits and vegetables, more things that grow from the ground. All right, we want to eat things that are lower fat, all right, and that are more healthy for our heart. So lean meats, if you're going to eat meat, lean meats, okay? Stay away from the center sections of the grocery store. That's where all the processed stuff is at. Stay on the outside sections where the more the fruits and the vegetables are. Go to the farmer's market. Y'all, we know that right now prices at the grocery store are crazy high anyway. All right, so stay with the stuff that's a little bit, go to the farmer's market. It's cheaper. Or build your own garden. All right, we're going to be talking about that too. Dr. Edwards has a garden. I'm going to be talk with the doc about gardening, because that's a good idea and a good way to help stay cardiovascularly healthy as well. All right. So you're going to want to stop smoking. You're going to want to not work on your weight. Okay. You're going to want to eat healthy, and you're going to want to move your body. All right. So one of the best ways that I have addressed my cardiovascular health, and guys, I used to have high blood pressure. I don't anymore, but I used to have high blood pressure. Was by exercising and moving more. Listen, guys, you don't have to go to a gym. You don't have to have a gym membership. You don't have to join a gym. You can get out and walk. Okay, walk around your block. All right, you can get up and dance. Turn some music on. Remember back in the old school days when Mama would get up and she'd be cleaning the house and she'd have the music on and she'd be sweeping and mopping, but she'd be dancing while she's doing it. Right? Did you know that that's burning calories? Yeah. It is. So make sure that you are exercising and moving your body. Find a way to move your body. All right. And the more you move your body, the better you are increasing the blood flow to your heart, the blood flow to your lungs, increasing your oxygen, and you are helping with your metabolic rate. All right. Your metabolic rate, as it increases, you're actually going to be burning calories while you're just sitting. All right. We'll talk more about that as well. So to help improve our cardiovascular health, we are going to be stopping smoking. If you're a smoker, you're going to be losing weight. All right, losing fat is actually the most important thing. You are going to be eating healthy diet. Okay, low in fat and higher in your lean red meats, your fruits, your vegetables, and your healthier foods. And then you are going to be exercising and moving some more. All right, and last but not least, I want to tell you guys, if you are on medication, you need to take it the way your doctor has prescribed it for you. Let me say that one more time. If you are on medication, you need to take it the way your doctor has prescribed it. Don't take it the way that cousin Nook from down the street told you to take it. They don't know what they're talking about. I guarantee you. All right. Don't take it the way that, your other cousin whose friend works at the doctor's office and they told you to take it like this. No. Talk with your doctor. Okay. And even though this show is called Talk with the Doc and you're talking with me today, even I can't tell you how to take your medicine. Okay. You need to talk with your doctor and figure out how to take your medicine. All right. Even when it comes to taking supplements. All right. You need to talk with your doctor about taking supplements. All right. Yes, I've got Abundantly Natural. Today's show is sponsored by Abundantly Natural, but you need to talk with your doctor about taking supplements. All right. Now, speaking of supplements, Dr. Nicole does have a supplement for cardiovascular health. All right. I call it heart support. All right. And so it's all things heart support. And the heart support has things like the CoQ10. CoQ10 is healthy fats, and it helps with your heart. All right. And so with taking things like heart support, it's helping to support the function of your heart, lowering your blood pressure, improving blood flow to your arteries, improving decreasing the fat in your arteries. All right. So these are the things that we want to do. So again, the CoQ10, it's got L-carnitine, it's got hawthorn, it's got magnesium. You guys know that there's different forms of magnesium. All right. There's magnesium glycinate, magnesium oxalate, magnesium taurate. There's all kinds of magnesiums. Each one works a little bit differently. So magnesium taurate is really good for increasing blood supply and blood flow. All right. So with heart support, this is a great way to help support. Now, this does not take the place of your medicine. Let me say that one more time so you can hear me right. This does not take the place of your medicine if you are on blood pressure medication. All right. This helps to support your heart. All right. This helps to support your cardiovascular supply. So you take your medicine and then you add a little support to it. All right. So again, with taking a supplement like cardiovascular or heart health or heart support, that can help to support your cardiovascular health. All right. So again, for the month of February, Dr. Nicole is going to be giving all of her heart support, all of her anti-inflammatories, 25% off, and I'll give you guys the coupon code. Well, I'll go ahead and give it to you now. We're going to use the coupon code HEART, HEART. All right, HEART, HEART, and that will be starting February 1st, and will run through the month of February. So you use the coupon code HEART, HEART, and that will get you a 25% off of all the supplements, anti-inflammatory supplements, and also all the heart supplements with Abundantly Natural. All right, so again, cardiovascular health is all about everything about your heart. We're trying to work this month. We're going to be working on decreasing our blood pressure. So we're going to do a show just on blood pressure. But let me just tell you, the normal blood pressure that you should be aiming for is 120 on the top number and 80 on the bottom number. Back in the day, we used to go up to 140 over 90. That is not considered normal anymore. You want to be in the 120s over 80s. All right, 120s over 80s. And we're going to have a whole show where we're going to talk just about blood pressure. All right, so but we're going to increase our blood pressure, decrease our blood pressure, and improve our blood pressure. All right, we're going to decrease the amount of fat that's in our bloodstream, because that's what causes clots, and that's what causes heart attacks and strokes. And we are going to improve our cardiovascular supply. That means how well does the blood flow and the oxygen flow back to our heart, so that we are supporting our heart. All right. So thank you guys so much for joining me. Again, this is Dr. Nicole Edwards, board certified family medicine physician. I help everyday people to understand these conditions, and I break down in terms that everyday people can understand. Again, please click like, share, and follow on my YouTube channel. You can follow me on all social media platforms at Dr. Nicole D.O. That's DrNicoleDo. All right. One more thing I want to talk to you guys about. Oh, and one more time. We are sponsored today. Talk with the Doc is sponsored by Abundant Life Concierge, and also by Abundantly Natural. Now, I do want to, on our last part of the show today, I do want to talk to you guys about one other thing that you can do to improve your health, and that is to have a healthy relationship. So we are getting ready to go into February, the month of love, the month of all things about hearts. And so I read an interesting article. Let me pull it up here real quick. And on this interesting article, it talked about ways to improve your health. All right. And I'm just going to read this real quick to you. This says the data shows that people who weren't married had a 42% higher risk of developing cardiovascular disease and a 16% higher risk of developing coronary artery disease compared to married people. All right. Unmarried people were also at a higher risk of dying from heart problems. And for people who were formerly married, the risks of heart-related disease were higher than for people currently married. Okay. People who were divorced had a 35% higher risk of developing heart disease, and people who were widowed had a 16% higher risk of experiencing a stroke. So now I'm not telling you guys to run out and get married. I'm not telling you that at all. But I am letting you know that we have scientific data that shows that people who are in healthy relationships, and let me just put this caveat out there. That's not just to say as soon as you get a ring that you lower your cardiovascular disease risk. This is healthy relationships, healthy marriages, happy relationships, all right? Because we know that when you are in a bad relationship and having more stress, you're actually putting more strain on the heart. So we are going to talk about love, right? And being in happy, healthy relationships. And so to help me do that, guys, I have the love of my life, Mr. Superior Edwards, here with me today as my special guest. Thanks for being on, Boo. Go ahead and introduce yourself.
I am Superior Edwards, and I get the privilege of being married to this fine, beautiful woman.
All right. And so we are going to talk just for a few more moments here as we wrap up the show today about all things relationship and all things how do we as a couple have a build our cardiovascular supply and work on our marriage and relationship so that we can have healthy hearts, so that we can be around longer for each other and for our children. So one of the ways, go ahead. So what do we do to help build our relationship and work on our relationship?
Well, I don't know where to start. Well, we work as a team. That's the first thing with everything we do as a team. Even this that you see now, we doing this as a team. While she been talking, I've been putting up the words. So
he's a great producer extraordinaire. Okay, of music, TV, video. He does great production work. So he is my producer. So this show is also sponsored by him as well.
yes, we do, and then we do a lot of things together. Like we enjoy life. Like even our dates. Our dates don't always have to be roof Chris. Um, Sometimes bike riding together, roller skating, bowling. We do a lot of stuff that's active. That where it's not always just we get dressed up. I like to get dressed up. I love to wear suits and ties and get dressed up and go nice places. Go see Charlie Wilson, one of our favorite artists to go see. But we also do a lot of active things together so we can stay healthy physically. And then what we do as a couple to stay emotionally attached is we do a lot of talking. We communicate. We talk all day. Even it's the little things. Texting. We always checking up on each other, making sure we good. And I feel like relationships should make your life easy and not hard.
Yes, and that's a good point. So because we know that again, when you have increased stress, that puts increased stress on your heart. Okay, and stress also increases. There's a hormone called cortisol. And we are going to do a whole talk with the doc about hormones later on in this month and how it affects your heart. But when you are in good relationships and having good relationships, you are actually releasing your good hormones. All right. And you should be in a relationship. Now, we know that there's all different types of stress. There's good stresses and bad stresses. And so sometimes stress can't be avoided, but you want to make sure that you are in a relationship that is less stressful and putting less stress on your heart. So you want to make sure that you have a relationship that is supportive, that you have someone that makes you feel good, and that is releasing your good hormones. All right. And we're going to talk about good hormone release on another show. But so one of the things too that we do together, in fact, we put up a post earlier today on our social media, is that we work out together. We work out together a lot. We push each other. I've seen some really good workouts for couples. We haven't done those yet, but where they're actually like passing the medicine ball to each other, and they're, I lay down and you do a sit up, and then I sit up and we pass you the ball. So there are couples workouts, and so those are a great way to do it. But you don't have to do all that. Sometimes just like he said, taking a bike ride together. Sometimes just taking a walk together. Mm-hmm. All right, and you want to do something where your heart rate is getting up. Okay, this morning he was riding the bike and I was doing more functional strength training. So doing some circuit training, but we're both in the same room and we're able to talk while we're doing it. Right. It's harder because our heart rates are up, but we're able to talk. But we want to make sure that we are doing some form of exercise again every single day. And we like weekends because we get to work out together. Our schedules allow us to work out together. And we even try to incorporate that with our kids too. We're trying to teach our kids, to get up and to be healthy and be active and to move your bodies more.
Which can be very difficult, especially right now in the COVID season with, a lot of people are doing homeschool. And so what we try to do, a lot of times I'm the one that's tasked with doing the homeschool because my schedule is more flexible. So my kids do the Peloton now. And then also it's a healthy lifestyle. Our kids think like when I was growing up, vegetables was nasty and disgusting. Our kids love it. If I give them some celery, and they love it. One of my son's favorite meals is a Mediterranean salad. He can eat Mediterranean salad every day. And it's nothing but cucumbers, tomatoes, and
onions.
Yeah, and onions.
We should do a cooking show one day.
Yeah, we should.
Yeah, we will.
But because it's our lifestyle, they don't look at it like as, oh, this is nasty.
Your mom was even shocked that time when they asked for asparagus.
Right.
Our kids asked for asparagus. How many of y'all's kids asked for asparagus? Right. But if you make it good and you incorporate that into their lifestyle, then they will they'll enjoy foods like asparagus. And so that's one of the ways that we have incorporated that into our relationship, and into our family. So make sure, guys, that you are addressing heart health together as a family, right? So get your healthy relationship going. And like I said before, relationship does not have to be marriage. But if you are married, make sure you are working on your marriage. Make sure that you are improving your communication. Make sure that you guys are doing things together outside of just, a lot of times people have relationships in passing. So, I'm coming home from work, you're going to work, right? And so but you have to schedule times to spend time together, quality time together. You have to schedule times to go out on dates. You have to schedule times that we're going to exercise together, times that we're going to,
even vacations. Like, what we learned was this: a lot of times family vacations can be work because you don't get to sleep. Like, when you go on vacation, when we go on vacation, just us two, there's no pressure to wake up in the morning and make sure the kids eat breakfast, make sure they at their activities, because our kids are still young and need to be supervised, so they're not teenagers where they can just wake up and, oh, we're gonna go to the pool. Okay, I'll be back at 12 o'clock. Our kids not at that age, so being that they still young, a lot of times our family vacations become work. So now what we learned was, okay, so we have to do a family vacation, then we have to do a us vacation, so we can be healthy and still be able to give to them.
right. That's a good point too. A lot of times, if you, as the primary relationship, are not healthy, then you can't give to the other relationships, right? So, but I hate cliches, but you can't give from an empty cup. But again, if you don't have enough reserve between the two of you for the primary relationship, then you're not going to be healthy enough to give to other relationships, like your children, or even like your other family members, your siblings, your parents, your friends. So you've got to be in a place where your core is healthy. This actually spills right into your body, right? So your core, meaning your body, your heart, the inside, needs to be healthy so that it can keep the rest of you healthy. And the same thing with the relationships. Okay, so again, the data is showing that people who are in healthy relationships and healthy marriages have a 42% lower risk of cardiovascular disease. All right, they also say that married men live longer. Go figure.
That's what they say.
That's what they say. Married men live longer. Now I wonder, could that be because they didn't say about the women, because maybe the women have more stress.
I think, okay, let's dive into this. Okay, I think because from being single and being married, like most of my friends, I would say we all have gained weight once we got married, and in our culture, I think we call that happy
Happy
weight.
weight.
Because what happens is we have somebody that comes home, we get to come home to, they take care of us, they cooking, and it's different. And yeah, so I would say, yeah, I think it does make you live longer because really you have a partner, and relationship is a partnership. It's a deep friendship. So when you have friendship, you should be able to live longer because everything is not on you. You are sharing, and because there's sometimes I delegate. There's these situations in the house where if I do it, I'd be like, yeah, you, that's you. I'm gonna let you take care of that, and I'm gonna go back in the room. And she does the same thing. There's certain things like, oh, like, your son, you need to go, you need to go handle that. And it does make it easier because you're working as a team. Because no one don't feel like, oh, I got to do everything. So I think the data is true and accurate from my experience because versus we sharing our responsibility, we sharing life together, even exercise, we doing that together. So
And since you brought up delegation, I will say that another thing that helps to make a relationship healthy, to make your own heart healthy, to make your own body healthy, is to delegate the tasks that you don't want to do. Okay. So, like, I hate washing the walls, washing the baseboards, scrubbing the floors, delegate that. If you can afford it, find somebody to clean the house. All right. because what does that do? That takes away that task from me or from him, and we're able to let somebody else do that, once a month or once every 2 weeks or once a week, however much you can afford. But that gives us more time for us or more time for our family. So if you can find things that you don't have to do, that you can delegate to someone else to do that. That is a way to make your own self less stressed and own self better, improve your heart, and it also improves your relationship. So make sure, yes, delegation is key.
And from the male perspective, I'm gonna tell you guys, for all guys, when you want more us time, you time, and the goodies. Really taking things off her plate gives her more energy and more time to do that.
And
So even if you can't afford it and you decide, you know what, babe, I got this. Tuesdays and Thursdays, don't worry about dinner. I cook those days. I take care those days. Because what happens is now you freeing her up so she can be able to give to you, which helps create a healthy relationship.
absolutely. Healthy relationships, healthy hearts, and all things heart health as we are going into February. Thank you, babe, for that insight and for coming on Talk with the Doc today. Y'all like having Soup on? Yes. All right. I think I'm gonna have him on some more shows to bring the male perspective and to bring, you know what? What we might do is we might just bring him on the shows for the heart month. All right. So for part of the heart. So again, this is Dr. Nicole. We are getting ready to wrap up. Though I want to thank you all for joining me for the rebirth of Talk with the Doc. We are back talking all things healthy on how you can live a whole person healthy life, mind, body, spirit, and finances. Again, I am Dr. Nicole Edwards, board certified family medicine physician. I help overworked, overweight, and overwhelmed people to transform their life, whole person healthy, mind, body, spirit, and finances. We are sponsored today by Abundant Life Concierge Medicine and also by Abundantly Natural. Today we have talked about all things heart health. We talked about COVID-19 and how it affects the heart and how to decrease the effects on the heart by avoiding the spread of COVID. All right. Wash your hands, wear your mask properly, get vaccinated, socially distance, take your vitamins and your supplements. We talked about how to live and to improve your cardiovascular health, how to improve your blood pressure, how to decrease your the amount of fats in your bloodstream, which lowers your risk for heart attacks and strokes by stopping smoking, eating healthy, exercising, losing weight, and by taking your medication and taking your vitamins. And we talked about all things love as we get ready to go into February, heart health month, and the month of love, the month of February. We talked about how to have a healthy relationship and how healthy relationships decrease stress, also decrease the strain on the heart, and improve your heart health. All right, guys, I am Dr. Nicole Edwards, and I would again ask you to do me a favor and click like, click share, and click follow on my page. Let everyone know that Talk with the Doc is back. We are going to be live every Sunday afternoon at 5 p.m. Eastern Standard Time. Also, remember, use the code HEART, HEART, at Dr. Nicole D.O. That's DrNicoleDO.com. Go to the shop inside of there. You can get the cold and flu bundle. You can get the heart support. And if you use the coupon code HEART during the month of February, you will get 25% off of all anti-inflammatory and all heart or cardiovascular related supplements. All right. I'd like to thank you guys again for coming on and joining me live on Talk with the Doc. And I will see you next week. Again, click like, share, and follow, and I'll see you guys next week. Have a great one.